My name is Dr. Richard Stefanacci. I'm an associate professor at the University of the Sciences, as well as a senior physician at Mercy Life. I'm going to be speaking about Alzheimer's disease, therapeutic updates, best practices, and barriers to care. The learning objectives for our program are to describe the pathophysiology of Alzheimer's disease, the challenges associated with diagnosis and treatment, the diagnostic recommendations as well as treatment options, and we'll end with a case presentation that will tie this all together, from diagnosis to treatment to management. To start with, it's important to understand the pathophysiology of Alzheimer's disease. A few key areas to really pull out of this slide, actually there's 5. Tau protein and amyloid plaque are considered the 2 most likely pathologic changes to the brain that cause Alzheimer's disease. It's not known yet which is more important or the degrees that each one of these 2 play. But it's important for our discussion when we talk about treatment and management, as well as the diagnosis, to remember that tau protein and amyloid plaque are key. Now, the other parts to remember and really think about are that the cerebral cortex, hippocampus, and ventricles are key in the brain and are most likely impacted by Alzheimer's disease. And you can see here on the right, as we progress from a healthy brain to mild Alzheimer's disease to severe Alzheimer's disease, those 3 areas, the cerebral cortex, hippocampus, and the ventricles, are impacted. And this is going to be important again when we talk about diagnosis, treatment, and management. So let's remember these points and really, again, continue to discuss them as we go through this presentation. When we look at the projected prevalence of Alzheimer's disease, you can see a tremendous increase in the number of cases, really doubling over the course of the next several years. And the reason for that is the over age 85 population. So as you can see in blue there, the big increase in the overall of the total number of cases is really occurring as a result of that patient population. And that's because we're doing such a great job in managing chronic conditions that patients are now living much longer. So the largest percentage age group for seniors is really that over 85 population. And I can tell you, as a practicing geriatrician, when I did my geriatric fellowship, I never thought that I'd be managing patients with HIV. That's now a chronic disease, as well as some cancer. So we're able to improve longevity, and as a result, we're seeing more patients that are dealing with Alzheimer's disease, as that is much more prevalent as we're seeing in the older population. Now, when we look at the next slide on the cost of care for people with Alzheimer's disease, going along with that increase in the number of cases is a significant increase in the cost of care. And you can see all the way to 2050, we're going to be over $1 trillion per year in the cost of care. And primarily the cost of care here is the caregiver involvement, whether it be institutionalization in a nursing home, assisted living facility, or just a burden on caregivers for caring for somebody with Alzheimer's disease. Now, we're going to spend some time talking about, again, the recommendations regarding diagnosis and treatment. And a lot of what we're going to be discussing comes from this article. The lead author was Howard Phillott. He brought together a panel of experts to bring about recommendations for best practices in the diagnosis and treatment of Alzheimer's disease. And again, we're going to use this as a foundation for our discussion. So let's take a moment to talk about diagnosis. As you see in this first recommendation, early detection and diagnosis of Alzheimer's disease and the related disorders is critical, and I can't stress it enough, critical to achieving optimal quality of care. And the statistics are really staggering, that over 3/4 of the cases are not diagnosed until moderate to severe levels. So we're not diagnosing our patients in the earlier stages of Alzheimer's disease. Again, the vast majority are not diagnosed until they get that moderate to severe. And you can see in this next point, the diagnosis to death, in an academic setting where the diagnosis is made earlier, patients from the time that you're diagnosed to the time that they pass away is 6 to 9 years. In most clinical practices, it's only 3 to 5 years, and again, that's because the diagnosis is often delayed. And again, the recommendation is that diagnosis occur as early as possible. And as we get treatments that can affect